Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy. And this month, we are going to be talking about a serious crisis that we are in. And if you're listening to this during the time that these are released, it's likely that we are still in the COVID-19 or coronavirus crisis, but that crisis is going to come and go. And this one that we're going to talk about this month, apparently is not coming and going, and it needs to be addressed and it needs to be talked about because it is extremely serious and certainly will affect many more people than the coronavirus will. And what I'm talking about is I'm talking about the opioid crisis. Every single year, about 16,000 people die from the use of NSAIDs. That's non-steroidal anti-inflammatory drugs, or in other words, ibuprofen, Tylenol, Advil, Aleve, naproxen, BC powders, that kind of stuff. 16,000, but about 60,000 people die from overdosing on prescription painkillers. 70% of all opioid deaths are the result of musculoskeletal pain. Basically, people were trying to get out of musculoskeletal pain, which is, back pain, neck pain, knee pain, shoulder pain, elbow pain, wrist pain, migraines, carpal tunnel syndrome, those kinds of things. 70% of all opioid deaths happen because people are trying to get relief from those kinds of problems. 59% of all opioid prescriptions are written for back and neck pain. 1/3 of orphans in this country, their parents are either dead or they're in a treatment program because of opioids. Every 19 minutes, a baby is born dependent on opioids. And in 2019, we lost 155 people per day due to opioids. And my question to you is that if we had 155 people per day die from plane crashes, I think we would fix this problem pretty darn quick. 4 out of 5 people that are hooked on heroin got there because they first were on prescription painkillers. So, what are opioids? The word opioid covers a lot of different categories. Opioids could consist of medications prescribed, for alleviating pain, but they also can be illegal drugs like heroin, synthetic medications, that can be just downright deadly. The epidemic related to opioids refers to the advancement of both non-prescription and prescription opioid drugs, and the utilization for medical objectives and non-medical objectives. In 2015, about 2 million people out of the estimated 20 million citizens that had significant substance abuse disorders experienced a disorder involving prescription painkillers. Another 591,000 experienced a disorder that had to do with heroin. And during 2016, 116 individuals died every single day. And again, as you heard earlier, that number has gone up to opioid-related deaths of 155,000 per day in 2019. So we're going to talk about some opioids, identifying abuse, hopefully preventing addiction today. So opioids are medications that are typically prescribed to assist in controlling some kind of pain, especially after things like a major surgery. The whole group of medications is quite extensive. There's synthetic, but there's also some natural substances as well. Opioids break down and integrate with the receptors in your brain, which minimize the perception of pain and also creates a feeling of relaxation and euphoria. So you can see why people would get addicted to them. So when are they prescribed? Utilized for treating moderate to critical types of pain. Pain can be acute or chronic. Acute pain simply means that it's only there for a short amount of time, or they've only had it for a short amount of time. Whereas chronic pain, on the other hand, is typically pain that's going to last beyond, let's say 3 months, and it happens with diseases, such as arthritis. It can happen even with cancer. Those things can be very painful. Opioids are often seen as a last resort, which means that they are often turned to when other pain therapies or medicines aren't working. However, certainly have seen them be more of the first line of defense as well, but I think more and more doctors are turning away from them and not prescribing them because they're such a huge problem. Whenever opioids are taken over a long period of time, the dosage required for creating those euphoric feelings tend to increase. Yet the different feelings of pleasure gotten from opioids could lead to, unfortunately, addiction. So whenever the opioid does start wearing off, you might crave those, pleasurable feelings for sure if that's happening. So how does somebody prevent taking opioids? Well, in case you recently underwent surgery or have severe pain, you just want to work really close with your doctor to choose a treatment that's best for you. Work with your doctor to know what the best treatment options are. But if you desire a more natural treatment, to pain, without experiencing any kind of side effects, you might try, physical therapy, massage therapy, chiropractic, acupuncture. There are a whole host of things that you can do that are non-drug treatments. So, what can you do to minimize the risks? Certainly, listen to and follow your doctor's directions. However, be very cognizant that you do your own homework when taking those things, and also be aware of your family history. So if you have any sort of addictive tendencies in your family tree, or maybe in your personality type, you definitely want to be aware of that. Take opioid drugs for acute pain for only a reasonable amount of time. And again, I'm not a medical doctor, so I can't tell you what to do or how to do or when to take them or not take them. Not trying to give you advice, just trying to tell you, like, when you do talk with your doctor about these things or do them, definitely pay attention to the recommendations that you're getting. And just make sure that you tell your provider about every single thing that you're taking, including supplements, vitamins, herbal remedies, over-the-counter medicines, all of those kinds of things. Because opioids can completely be avoided at times, because a lot of people are scared of side effects. They're scared of potential addiction that actually comes with them. So if you're in pain, if you're having any sort of pain-related disorder, no matter what it may be, certainly consult your doctor. If you are so inclined, you are more than welcome to search out other natural methods that are out there, and there are many more than you've probably even heard of. And I hope this was helpful to you. This is Dr. Jason Jones. Hang in there for the next ones, and we're going to be giving you guys some different things you can do, certainly for pain, but they're going to be educating you more on opioids in this crisis that we're in. Signing out. We'll see you guys on the next podcast. Bye-bye.